I am so happy to be here. I don't care if it's the first day, the second day, or the last day. I'm just appreciative to have you in your seats. And I wanted to tell you that I loved the theme of this event, Ignite the Spark. And so I always like to start off with some kind of like group activity. I'm not going to ask you to stand up and hold hands and sing Kumbaya unless you want to, and then we can do that too. But I have engaged some of the staff members here to do me a little favor. While you all were sleeping last night, we snuck in here, and we installed some devices. Don't touch it. We've installed some devices underneath your chairs, okay? I'm going to ignite the spark. You get where I'm going with this. Don't be scared. All right, so I'm going to ask you some questions. If you say yes, you'll stand up. If you say no, you'll stay seated. But remember, these chairs, devices that we installed, are designed to sense if you are not actually being truthful. So if you stay seated, all I can say is anyone sitting around you might want to find a different place to sit if you're not being truthful. Okay, I'm going to start with an easy question. All right, how many of you have made an impulse purchase that you regret? Stand up if yes, stay seated if no. Oh, okay, there you go. A very wise, frugal man sitting right here in front. Okay, go ahead and sit right back down. How many of you have lied, yes or no, about your birthday at a restaurant just to get free dessert? Yes or no? Thank you for your honesty, sir. Thank you. Okay, one more easy question. If you own socks that show you left or right, how many of you, yes or no, have actually put them on the wrong feet, even though it tells you what foot to put them on? Thank you. Me too. I've done that. All right, here's the last question I have for you. How many of you have lost any amount of sleep, hair, or part of your sanity because of today's current healthcare finance situation? I would expect everybody to stand up on that one. Okay, thank you for playing the game. I appreciate that. So today we are talking about leading the health equity conversation and why it pays. Health equity is a conversation that a lot of people are having, not always in the best context. Today we're going to be talking about it just focused on the importance of your work and the valuable resource, the asset that you are to your community. Health equity, a very simple definition as you see, is the state in which everyone has a fair and just opportunity to attain their highest level of health. When I started working in healthcare, my very first major healthcare client was the University of Illinois Medical Center. And with the University of Illinois Medical Center, aside from the hospital, I was responsible for working with the director of all their FQACs and very underserved. At the time, that was the big phrase that we used, underserved. I like to call them under-resourced because there are a lot of people in healthcare who are there to serve. But you can't serve people without the resources. And I just remember the joy that I felt, and I didn't experience this before, the joy that I felt when we opened up a community health center where one did not exist before, and people lined up just because they had an opportunity to have screenings, have their kids seen by a pediatrician, there was dental care. In so many of the communities I work, and I've worked in 43 states, there are so many communities. I worked in Forks with Sarah that have one dentist in the community. So health equity means that each of us has the opportunity to attain the highest level of health, but man, we have a lot of roadblocks. And I use this ripple effect that you see because you see, when everyone has access, it ripples out into the community, and we have healthier communities. And I mean, is there anyone here who doesn't want your community to be healthier? Rural in particular and urban have the reputation for being older and sicker and poorer. And that's just not some quirky narrative, that's our reality. So if we really think about how you can influence this kind of change and it ripples out to your community. But the reality is, if we don't have access, there really isn't any equity. Access to prevention of diagnosis and treatment and management of diseases, all these things. If you have limited healthcare resources, let me ask by a show of hands, how many of the places that you work have primary care shortage issues. That's pretty much the entire country right now. Transportation barriers, significant challenge for people. Prescription drug costs, too high. People can't afford their drugs. Or there may no longer be a pharmacy in their community. And then, of course, lack of health insurance. And we're going to talk about that. I was talking to the group last night about the fact that we are looking at the possibility of 15 million people no longer, they'll be, as they say, kind of kicked off the Medicaid rolls. They are still going to need health care, and they're going to end up at your door uninsured. All right, so no matter the number of health facilities, doesn't really matter, far too many people, their care is out of reach. For 3 years, I hosted a podcast called Rural Matters, and Robert Wood Johnson Foundation underwrote us, and we did an entire series focused on equity. And one of the images that they showed, which was really interesting, because a lot of folks don't think about the difference between equity and equality. So the image that Robert Wood Johnson put up was on the top row, there was people of all different shapes, sizes, and so forth. Each of them had the exact same bicycle. So that's equality. Everyone had a bike. But equity was that they had a bicycle that was built for them. And so that's the difference here. So inadequate health insurance coverage contributes to health disparities. Out-of-pocket medical care costs may lead to individuals foregoing all the care that they need. We know that during the pandemic alone, so many people did not continue with their important wellness needs and so forth. People with lower incomes are often uninsured. You know this. The minority groups, they account for over half of the uninsured population. And then I wonder this question, because I talked to quite a few CEOs, and I know that the prior authorization situation that we have going on right now might even be a new barrier to care that we didn't even recognize a few years ago. And we don't have any control over that as individuals, but we do when we advocate together. So you're feeling the impact. Look at these numbers. It shakes me to my core. Since 2000, hospitals of all types have provided almost $745 billion. You could bail out a bank with that, couldn't you? Uncompensated care, and ER is primary care. Let me ask you this. How many of your healthcare organizations serve a lot of primary care needs in your ER? Because there's a lack of, it's a domino effect, right? The ripple effect works both ways, good and bad. So $28 billion in charity care, $22 billion was for uninsured patients. I am no mathematician, and I'm going to confess I'm not a financial person, but I see that number and I know it's not good. We can all agree on that, right? So cutting to the chase, kind of going along with my ripple theme, health inequities account for $320 billion in annual healthcare spending. And that's a dire warning. This comes from the U.S. Census Bureau, and basically the bottom line was, if stakeholders, that's all of us and all of the people who work with you and everyone in your community, all those influential voices, if we do not figure this out, we could reach $1 trillion. I can't even imagine in my mind what that looks like with a stack of cash. How many banquet rooms would that fill up? So at some point down the road, if we keep doing the same thing and expecting a different result, I think the definition of that is it is insanity. At the end of the day, you can go to Washington, D.C. like I do with the National Rural Health Association Policy Congress. We walk around, you go to your state capitals, you tell them what the challenges are, but you go home and the same thing is happening every single day. We have some serious national problems. You have challenges in your own states of Alaska and Washington. I'm going to share some statistics with you a little bit later. But there are local solutions. And it's difficult to see those local solutions when you're drowning in so many challenges in your community. But I'm going to introduce you to some ideas today that hopefully ignite some ideas and spark you to do something a little bit different in your community and see if you can make a difference. I was talking to a fellow Minnesotan this morning, and we were talking about the fact that, we can't move the dial and expect changes tomorrow or the next week or maybe the next year, but if we can make incremental changes, if we can get more people to engage with us, our stakeholders, we can make a difference. So the three things I want to focus on for the time that I have here with you today is that first is that we address the barriers that you can control in your own organization. Now, I don't have an opportunity to know exactly where all of you come from, if you're in a health system or a small hospital or a larger hospital, but any way, shape, or form, you still have some barriers that you can take out of the way and make health equity a system-wide, leadership-driven. A lot of times when I'm called in to work with hospitals, leadership teams will tell me to that fix customer service or improve communication and things like that. And the first thing I ask them is, what are you willing to do? Because it starts with leadership. Health equity is not going to happen from the bottom up, the middle down. It happens with leaders, and it works its way throughout the organization. We're going to talk about shifting and sharing the burden. I mentioned earlier about all the newly uninsured people. That's just a burden shift, is it not? It's not solving a problem. That's saying, here, now it's your problem to take care of. And then we're going to talk about being a champion of a culture of compassion. When the pandemic started, I was working, I should mention to you, I also work with the National Organization of State Offices of Rural Health, and I've had the privilege of working on National Rural Health Day for the last 8 years. And it's always about the power of rural and getting people really excited about rural health and celebrating our rural health heroes. And my, how quickly that excitement and that gratitude changed. We know we have a lot of challenges, but at the end of the day, we know we have workforce shortage challenges that are not going away anytime soon. What's the number one thing that we hear that the majority of the population thinks why people are leaving the healthcare workforce? It starts with a B and it ends with an out. We're talking about burnout. And our pipelines are not our pathways to healthcare careers. So might we champion a culture of compassion to restore and renew the passion for this profession so that health equity becomes something that our staff, our teams, you, me, all of us are driven to do. So let's address the barriers that you can control, because when you have the right tools and you use them as they are intended, you can make some really interesting things happen. You know, have you heard the phrase, if every one's a nail, or what was the phrase? If you're a hammer, then anything's a nail. Hammers don't fix everything, right? We don't use a screwdriver, well, some of us do, to pound a nail into the wall. It doesn't really work out well, but if that's the only thing you have at your disposal. So let's talk about that. This is a really interesting kind of, this came out of the National Academies of Science, Engineering, and Medicine, and I'm just going to kind of share you my version. The first thing that we can control is awareness. When you have your providers asking patients questions at intake, and they ask things like, do you feel safe at home, right? That's a question that people are asking. Sometimes the question is, do you feel secure in your meals, and so forth. So is anyone familiar with these questions that are being asked when patients are coming into your facilities for care? Any of you aware of these sets of questions? Sarah, you're aware of them? All right. So what happens with that information? It's checking a box. I believe with all my heart that if health organizations took the time to sit down as a group, from leadership to the clinical teams to the business office, and really understand the kinds of challenges that their community members are facing. How many of you do community health needs assessments? A lot of times people do community health needs assessments because it's an IRS mandatory thing that you have to do. Then I ask, what's your plan? Let me see your strategic plan to address those. And a lot of times people say, we don't have one. And then you just do that community health needs assessment the next time around. So think about what you can do to create a far more robust awareness about the challenges that your community, those members of your community are facing. And we're going to go through some of those point by point. So you have an awareness, and you're going to find a way to document what you're learning and develop programs based on what you know and what you understand versus what we assume. Then we take a look at adjustment. The interesting thing is data leads us to trends. Trends lead us to ideas. Ideas lead us to solutions. So if you've never taken on an initiative to make sure that you're aware of the health disparities that are affecting your community, that are creating less than desirable health outcomes, we can adjust our approach to make sure that the things that we are doing we're making sure that people aren't falling through those cracks. The next thing that we take a look at is assistance. I am not standing up here and telling you in any way, shape, or form that as a health system, a hospital, a clinic, that you are responsible for solving all these problems. This is where engaging your community stakeholders are concerned. Where can you develop programs that assist those who are in need so they don't fall through the cracks? And where can you engage your community partners to make sure that they are participating as well? So you can create programs to assist those individuals who need it. Then the other part of this is alignment. If you are the only organization in your community focused on wellness and health, there is a lost opportunity, and your local community is not aligned with your mission. I've heard I ask people, if they think people in your community are thinking about your hospital, your health organization when they wake up in the morning. They're not. They're assuming you're going to be there when they need you. And they shouldn't assume that any longer, because we are looking in this country at one of the largest numbers of vulnerable hospitals that we have ever seen. In 1994, 95, something like that, I lose track of time, I produced a very small, low-budget documentary film on the important role that critical access hospitals play in our nation's healthcare landscape. And back then, this is, when the critical access hospital program was just a budding new thing, we said, oh my gosh, no one's going to touch that program, it's a great thing, plus 1% reimbursement and so forth. And at the end of the day, we realized that we have, I'm the person who lays awake at night wondering about when the next rural hospital is going to close, urban hospital is going to close. And so if we don't talk to community members about the importance of how they can help be aligned with the mission of a healthier community, we're doing it wrong. It means we haven't learned anything. And then we take a look at advocacy. How many of you have gone to your state capital or the nation's capital to meet with your congressional members to talk about your challenges? Can you show me by show of hands? Well, I'm giving you an open invitation, because if they don't know, they will never understand, and if they don't understand, it won't be a priority for them. But you can have your community and your community partners advocate with you to improve health in your community. Don't be afraid of advocacy. It's not being controversial. I told the group that we were with last night at dinner, there's a wonderful book called The Hospital, Death, Dying, and Dollars in a Small American Town. Has anyone read the book by Brian Alexander? I got so mad reading it, I had to put it in the freezer a few times and stop and just cool off for a minute, because it really did open up my eyes. You know what I'm talking about? It really opened my eyes to how challenged our rural hospitals are. The people who are serving the people in your community, if we don't advocate for the resources they need, we are missing so many opportunities. You know this saying, the squeaky wheel gets the grease? That's what advocacy is about. In this space that we're in, we have to go back every year asking for funding. That means we have to be asking for funding every year. We cannot sit back and assume that the resources we need for a healthier community are just going to show up at our front door. It doesn't work that way. I wish it did. Millionaires don't show up and just surprise you with, checks to start a wellness center in your community. So you have to advocate for those things. You've seen this before. These are the kind of the short version of the social determinants of health. Are you in your organizations talking about the social determinants of health? A few of you nodding your heads. At the end of the session, I know you might have questions for me, but I'm going to have some questions for you because I want to hear how you are managing. I use the word managing because I really believe this. When we deal with things, who here likes to be dealt with? Anybody? No? Like, I'll deal with you later? We deal with that which we fail to manage. These are things that are absolutely, locally, in many, many cases, in our control. Of course, access to care and quality care, neighborhood-built environments, social community context, economic stability, so forth and so on. We know that the pandemic, and I wish I never had to say that word again, but the effects of it, we're still reeling from it. It just made vulnerable communities more vulnerable. Communities that were teetering on vulnerability, they moved to a category, and so on and so forth. We know this. I believe when you share the burden, the shift happens. It's about making shift happen, people. We cannot do it by ourselves. It is a huge puzzle to solve. This picture depicts all these people coming together to solve the problem as one community. I had the privilege, as I said before the pandemic, I had a big mind shift. I was traveling and embedded in hospitals. I spent once a month for 6 years in hospitals that many of you might know, and never really thought about it this way. So when I was planning a National Health Day event, I watched a documentary called The Providers. Has anyone seen that documentary? Oh my goodness, I really encourage you to look it up. It's about a small, federally qualified health clinic in Las Vegas, New Mexico, and one of their PAs, his name is Matt Probst. And Matt Probst was the feature of this film, and it talked about how these providers in this very under-resourced community went, more than the extra mile. They served such a unhealthy, poor, disease-stricken, opioid-stricken population. He's like, I am not going to let this happen on my watch anymore. So he went so far as to go to patients' home to look in their pantries and see what they were eating. Now, that's not practical. You can't have your providers leaving the clinic, but he said, we can't solve this problem sitting in our offices here. We have to go out to the people. So I watched the film. I reached out to the filmmakers, and I said, I want to meet this guy. And they introduced him to me, and as it turns out, he wrote a foreword to a book called 100% Community, 10 Vital Services Ensuring Surviving and Thriving. 100% community. So I met the authors, and I'm championing their book. I don't make a dime from this. I champion it because I believe with all my being that this is a solution. Take a look at this. We all have org charts, right? This is the 100% community org chart. And in the state of New Mexico, they were able to get legislation and money to start 100% community projects across counties all throughout New Mexico. A 100% community initiative to start is about $50,000. And when you think about how much money our counties spend on other things, which is fine, pools are good, right? Libraries are great. New road signs are wonderful, but at the end of the day, that does not solve the human condition that we have, which is the social determinants of health that determine whether or not someone lives a long life or not. So if you take a look at this org chart, you see food, housing, medical, and dental is one, behavioral health is a totally separate thing, and then transportation. Those are our surviving services, and then our thriving services. Maybe you never connected these dots. I hope that you will today. Parent supports, early childhood learning, community schools, youth mentors, and job training. How many of your communities have almost no childcare, access to childcare? Okay? We have a baby boom happening right now. I don't know if you know that, but we have a baby boom happening in so many areas. So let's connect the dots. I listened to the news this morning here. There's 2 grade schools that are consolidating now. On the news this morning, the mayor is tackling homelessness and food insecurity. So these aren't things that I'm just thinking about to depress you. These are things that are actually happening. So this is the construct for 100% community. Imagine what it would look like. Remember those billions of dollars being spent on uninsured patients? But what if you can't change their insurance situation, but imagine what would happen if you as a healthcare organization led a health equity conversation and you got together with community partners. You might not have all these services in your community, but you have enough of them and said, how are we going to, would you be interested in joining forces and aligning with us to create solutions so that we are championing a healthier community? Housing insecurity is rising, and we know that housing programs are really promising. Are there any of you here who've started in your communities a housing program at all to address your, it looks different in some areas. In urban areas, we know what it looks like, tent cities and things like that. Do you know what it looks like in a rural community? Families living together in the same house, right? Living in their cars, and still trying to get up and make sure their kids have what they need to go to school. So we need to be thinking about ways. In DuPage County, Illinois, there's a program called DuPage County PADS. And the executive director just does not give up. And finally, after 10 years, she was able to amass enough community partners where they pooled their resources, they got grants and funding, they took over an old hotel that was no longer in commission. They transformed the entire hotel into transitional housing with job training, healthcare services, dental services. They did drives for clothes so that people were able to have something decent to wear when they went on job interviews. And you know what happened? I mean, it didn't just like get off the ground, but now the whole community, there was a fear, as you can imagine, of, oh, we're going to have, it's the not NIMBY, not in my backyard kind of thing. And so think about what you might be able to do is, if you don't understand that housing insecurity, the unhoused is what some are calling, if you don't understand that in your community, how can you understand how to manage their health needs? Because the healthcare needs of a homeless family is different than a housed family. And I think you can connect the dots as to why. Then let's take a look at our food insecurity epidemic. I did some statistics here this morning. So in Alaska, anyone know what the percentage of families with children are benefiting from SNAP? Anyone have a percentage? 67% of the beneficiaries of Alaska's SNAP program are families with children. That's a big number, isn't it? Pretty scary. I think about that wonderful meal we had last night and how fortunate we are to have that. In Washington State, care to venture a guess? 59% of the families who benefit from SNAP. What's going to happen to the SNAP program? Anyone? It's being cut. And I'm not here to talk about the politics of it, okay? I'm here to talk about the realities of what happens. Will people no longer be hungry when their benefits go away? So think about it. As a health organization, what might you be able to do to address food insecurity in your community and connect the dots what that means for wellness? We know that nutrition, when you have a health problem, what's one of the first things your care provider talks to you about? Your diet. Are you water, fat, salt, sodium, all that stuff? What is the fastest growing trend in rural America with respect to grocery stores? They're gone? It's Dollar General stores. But bless their hearts, they're putting in mobile clinics in their parking lots, and I'm sure it's for the good of the people, owned by a private equity organization. So you know where I'm going with this. What can you do? Well, there's a hospital in Minnesota, my home state, that decided that they were going to do something big. So they got together with their community, and instead of throwing away the food that wasn't being consumed in their hospital, they built a really intricate compost system, and they planted a community garden. open and free to all who need it. The only thing is you have to go and you have to put your hands in the soil and you've got to feel. And then it got people excited about growing their own food. One program, plant the seed, be the spark. Either analogy works, all right? So think about what you can do to be innovative to start a food security program. In the pandemic, again, think about when your schools closed and children relied heavily on those 2 meals a day. My daughter was a former third grade, fourth grade school teacher in an inner city charter school. And on Friday mornings, she used to come with a loaf of bread and a jar of peanut butter and jelly, and the kids made their own sandwiches to bring home because it might be the only thing that they ate that weekend. So think about what your organization can do to address that. Maybe tackle one of these at a time. Certainly you're not going to be able to. You don't have the bandwidth, the capacity to do that. Now let's take a look at untreated health challenges. Have you heard the news that the United States has the highest rate of maternal mortality than any other developed nation? That's pretty shocking, isn't it? Untreated health conditions. When people find cancer too late, what happens? We know this. I am very fortunate. I will share with you personally, I wasn't even sure I could be here for this trip. My husband had his left kidney removed on Valentine's Day. They detected cancer because of a scan for something else. They caught it early, stage 1. Had he not, people don't have the privilege like we do, some of us do, to be able to go and have an incidental pickup of a cancer. So when we think about untreated health challenges that drive poor health outcomes, but when we have access to dental care, you might not, I know rural health clinics don't get reimbursed, FQHCs do, I understand that, but what are we doing to make sure that we recruit dental care for our community and not just look at primary care, because dental care is primary care. And when we lack that service, there's lifelong challenges for people. We know that. It's so easy to kind of put these things in the back of our head and say, well, what can I do about it? Exactly, what can you do about it? There is a way. What we need is a collective will to say, this is a challenge we're going to accept. Mental health challenges. We are hearing this every single day. All the talk about, we need to increase access to mental health services. That's a nice sentiment, isn't it? But at the end of the day, what can we do to make sure that there's access to mental care, health care, and be a priority? El Centro Community Clinic in Las Vegas, New Mexico, they started a behavioral health program in their local school. So not only do kids have access to behavioral health in the school setting, which is potentially just life-changing for them, their parents do as well. And so when we work with behavioral health, we don't then have the highest incidence of teen suicide. I mean, I know there are many communities I work with, they say, Michelle, our kids, we have the highest rate of vaping. We have a whole new resurgence of use of heroin, meth. This doesn't happen because there's just, abundant resources. There is some serious disparity. And as I said earlier, I'm not saying this to depress you, although I realize I might be doing that right now, is that they're going to be showing up in your emergency rooms. And what then are you supposed to do? So the more that you can manage this on the front end, the less you have to deal with the really detrimental outcomes that happen because we don't have the resources. Lastly, transportation challenges. Well, it's not lastly, but I want to pull some stats here. There's an organization called Phoenix Mobility Rising. I asked the question, how many of you have transportation challenges? What happens when people don't have transportation? They don't show up. Their kids don't get their annual wellness checks. They're not coming back to have their blood pressure checks done, their diabetes, and so forth. And in some communities, transportation is not an issue, but means to pay for that transportation is. But in so many communities across this country, I mean, we got an Uber last night to get to the restaurant. That does not exist in most communities. So I met a woman named Valerie Loeffler, and she started an organization called Phoenix Mobility Rising, and they're all focused. It's all grant driven, so there are many grant opportunities. I don't know how many of you are on the lookout for grants that are available to you, and even though it might be a $10,000 or $20,000 one-time grant, don't you think that $20,000 or $30,000 could go a long way to driving change in your community? And that's exactly what she did. So she's working in Michigan, and she's working in Minnesota and other states, and they work with local people who qualify. You know, you have to do background checks. They have to have a valid driver's license, a properly working vehicle. And now it's community members giving community members rides to their appointments. And if you think about someone who is in a community that doesn't have a cancer treatment center, for example, I happen to know someone I'm working with right now whose family member is driving every single day for 7 days back and forth for treatment. 7 days, having chemotherapy. If you know anyone who's going through that, you understand how debilitating it is, and to be sitting in a car, nauseous and so forth. So think about what you can do locally to create a transportation solution for those who don't have access to a working car, there's no public transportation, so on and so forth. Isolated parents struggle. What happens with, there's a difference between isolation and loneliness, if you aren't aware of that. It increases substance use and disorders. So when parents are isolated and they don't feel like they have the support that they need, it creates the highest rates of depression and anxiety in children. And there are studies out there that have been tracking this that show that children who've lived lives with parents who've been isolated, as they get older, they present with diabetes, hypertension as an adolescent. What's happening to us to not recognize that this is an opportunity? Of course, increased rates of heart disease, so on and so forth. So when we provide parent supports, we can lift up an entire community. I've done a lot of, shall we say, observations in hospitals, so I'll sit front of the house, back of the house for days. Nobody knows why I'm there except maybe the CEO and somebody else, and people think I'm an auditor or something like that, which is fine. And I observe conversations in kind of the back of the house, in customer service centers and billing centers. Everyone has a different name for it. And I have literally, and I'm not saying this to fault anyone, I've literally heard back into the conversation when someone in a billing office hangs up the phone and they just talk to somebody who is talking about how they can't pay their bill. And maybe just inadvertently, things come out of the mouth talking to somebody else like there's no one watching. And I hear them say something disparaging about the individual, like, I know they really have the money, or, here we go again, I saw her getting her nails done and so forth. So I think about the fact that when we hear the stories of people who are struggling, what do we do to lift them up and find them? Remember, I said assistance, and find them solutions for those. So what can you do to make sure that the parents that you're serving have the support that they need, not because you alone are doing it, but because you are engaging your community stakeholders to help you? So let me ask you this. What percentage of your community is worthy of having the services they need to survive and thrive? What percentage? 100%. What percentage of your community has the services they need to survive and thrive? That's an unknown number. So I'm encouraging you, and if you want the information, all you have to do is reach out to me and I will get it to you. If you were to take your community health needs assessment and then overlay on top of that a 100% community assessment, you can very clearly see how the gaps that I've talked about absolutely relate and correlate to the health disparities that you're seeing, hypertension, diabetes, so forth. You will see it's like magic. And now we're talking, because not just a solution for the medical community, This is something for all of the people in your community that provide these services. So the first thing is survey your community. It's a scientific, I know people in this profession love their data, and data-driven decisions are the most important things that we can do to ensure that we are being good stewards of our assets and our resources. So surveying your community, your county residents, and I look at this as a county-wide. Even though you may not serve your entire county, partner with another health organization in your county to do this. Because you alone cannot fix this. Together, you can make a difference. Review the survey results and identify those service gaps. If you don't know what you don't know, from there, you assess the 10 surviving and thriving services. What are you lacking? What kind of conversations can you have with neighboring communities who might have solutions? If housing is a challenge, talk about that. If transportation is a challenge, maybe you've got something that they don't. It's really all about collaboration. I said 2022 and 2021 is like a wash. 2023 must be the year, and moving forward, of collaboration. I know there's competition, and that's good. Competition's healthy, but collaboration is healthier. Provide an updated directory of services. When I start working with a hospital, the first place I go to learn about them is, where do you think? Of course, we go online. I look at your websites. And then I see, varying degrees of different information, mostly about your services and your providers. What would it look like if your website was the place that people went to look for the services they need to survive and thrive? Now, Sarah knows this. I've worked in many communities, and when they are looking to get their community to support a major capital project, modernization, replacement facility, or if there's a kind of a crisis going on and the community is fixated on one thing, I encourage them to kind of like blow the whole thing up and stop focusing on that issue or that problem. So then it becomes healthier. So it's healthier West End, healthier Morrow County, healthier Lafayette County, healthier Chelan. I've been to a few places here, lots of them in Illinois. Now we're getting our community to focus on healthier versus that which we need to heal from. You understand what I'm saying? So provide an updated directory of services. Make your website or build one with your community partners where everyone can access it. But remember, not everyone has broadband. Not everyone has little devices that they can turn into. So where are the community partners that you can turn to make sure that directory is accessible? Your faith-based organizations, your library. One of the other questions I ask any community hospital that I work with is, what is your relationship with your local fill-in-the-blank schools? Well, we have a nurse that goes in there. We write checks to the Booster Club a lot. Things like that. Think about ways that you can build more meaningful relationships so this information is accessible to everybody. And remember what I said, shift the burden. Shift happens when you share the burden, shift happens. Identify and innovate solutions to end these barriers. As we were saying, this is not an overnight sensation thing. It's not going to happen. But where could you be a year from tomorrow if you left here and said, we're going to have a courageous community conversation about the challenges before us. We're not going to hide behind them anymore. It doesn't make us focus on the negative. It puts a spotlight on the positive things that we can do because we've decided to make one small change, one movement. Get buy-in from your local government. This is a really, really important one. Because if our local governments aren't focused on these things too, what chance do we have to be successful? Is your county commissioners talking about these things, or are they spending more time arguing about how much money to allocate to a new piece of equipment? And I say this because I've sat through a lot of really painful county commissioner meetings and city council meetings. Have the conversation. As the health leader, make an appointment, sit down, invite them to your hospital, to your health center, share the numbers with them. Don't breach, patient privacy. Share the numbers with them. Help them understand how they can help you, because they are in a position to do much more, challenge them to do more than what they're doing. This is where the revenue is going to come and the resources will come, because state or county governments receive grants, and that grant money is allocated for the projects that are important to them. And if they don't understand how important this is to them and their community, why in the world would they go to bat for the things that are important here? Evaluate the effectiveness of your innovations. You know, it's really important for us, you know, we look at data, it's really important for us to identify and tell our success stories. If you don't evaluate them, how can you share how it's been successful? And then maybe instead of someone else reinventing the wheel, they can look to you as the model for how to make something happen. All right, so we got that. We talked about equity versus equality. We've talked about the 10 surviving and thriving services. But now I want to talk about championing a culture of compassion for all. Just be honest with me. How has the current workforce condition impacted your quality, your safety, and your patient experiences? Anyone have something they could share? My hunch is that even if you don't understand how directly related it is. Workplace bullying, shortages, overburdened, long hours, self-care. As healthcare people in healthcare, we're not all that great about taking care of ourselves. And I see this in all the places that I travel. I ask healthcare staff, when was the last time that you exercised in the morning, that you made sure that you were drinking enough water during the day, that you were getting enough sleep? I'm the daughter of a general aviation pilot. My father, God rest his soul, he was a private pilot. And if he didn't get enough sleep the night before we were going to fly somewhere, he was a danger to all of us. And it's the same thing with healthcare. So we think about how our current workforce conditions might impact health equity. If you are not talking about that, remember I said the awareness thing with your staff, when a community member comes in and they are challenged with their health, is your staff member looking at them in a way where they're saying, before me I see a person in need or a patient who I need to move up to, kind of get them down the line and get them to where they need to be. People do not get into this profession, I have generally found, because of, the money, although, they don't get it because people say healthcare is their calling. And the last 3 years have really challenged us to stay focused on that calling, which is why people are leaving the profession. There's an organization I love, they do this artwork, as you can see up here, Gaping Void. Our best work is seeded by passion. Compassion is a derivative of passion. Passion is a derivative of passion. So where is that passion? These are the human factors. If we're going to be aware, if we're going to increase our awareness of the needs of our community members who are being under-resourced, we have to be at our top game. This is very important, because when we miss things, when we have these people coming, your community members coming back because we failed to treat, we treated the condition versus the person, sleep deprivation, stress, nutrition, hydration, attitude, and decision making. If we're going to expect our teams to be aware and aligned and advocate, they have to be feeling appreciated, and they have to have the peace of mind and the health that they need to continue. I worked with he is a former commander in the National Guard, and he was an aviation instructor as well, Russell Hellstrom. And we teach a course on high reliability in healthcare. And I was fascinated by this because high reliability in healthcare, has anyone heard of the term high reliability in healthcare, HRO? So you understand the premise. It started out of aviation and then nuclear plants. So it's working in the most intense conditions with zero harm, zero accidents. Everyone still, I'm assuming this is true, everyone still has a mission of zero harm. Right? Everyone who comes through our doors No matter their ability to pay, our mission is to make sure that we treat them, and we treat them with the outcome of zero harm. So Russ, in his wisdom, he has done a lot of research. These are the error-producing conditions. And when we miss things, that's an error. So physiological degrading fatigue, unfamiliar situations, all these things. But what I really want to show you is this. Do you know, now you do, that when your team members are fatigued, that there is a times 50 chance of making a human error? So think about how you're lifting up your teams. Are you saying, can you pull an extra shift? Because we don't have anyone to fill in. And I'm not just saying this about clinical teams, because I recognize the burnout is real in every area of healthcare, whether it's materials management, HIM, IT, environmental services, dietary. Everyone's short-staffed, the number one thing I used to hear in hospitals when I would walk in is, how is everyone doing today? They say, busy. You know what I hear now? Tired. We've just replaced one with another, one negative energy level with another negative energy level. So we have to be making sure that we are taking care of our teams. How are you making sure that your teams, when you do your, I think about this. Are the business office and managers and finance folks, are you all being participants in your daily huddles? Or are those left to those who are doing clinical care on the floor? Anybody? Are you doing the daily huddle in your house? This is so important. How will you know how to, if we're talking about our entire organization cares for this population and we are not aware of what the situation is for everybody else, how can we be at our best? We are not human doings. We are human beings. So whatever you do, how are we choosing to be when we show up for the people in our own organization and for the communities that we serve? So being aware of the conditions that you can control in your organization, making sure that not only you say, take care of yourself, what does that actually mean? I encourage you to go back and take a look at your own kind of internal, I know you all have mission, vision, and value statements, and I'm sure each of you could stand up right now and recite yours for me. But what is your mantra for your team, working your team? Are you work, longer hours, more productivity, more productivity, more productivity? Or are we saying, take a step back, take a breath. Let's have a reality check about our own capacity. Because if we are not at our best, we cannot be our best for the communities that we're serving, and we are certainly not going to be able to kind of pull us up out of this nosedive locally. So there are ways to do it. There are ways to do this. This is your emotional bank account. We've heard a lot about banks this week, and how many of them, another one just got, a little assistance to make sure they didn't fail. Have you ever heard the term emotional bank account? Have you? So with your teams, if you're a leader, and if we're all leaders, you go in your team and you make deposits, I'm going to step in for you today because you've had a long shift and I'll take you off the phone. I'm making a deposit. That way, when you need to make a withdrawal because you need them to work an extra shift, you have sufficient funds to do that. What's happened now is we've just made so many withdrawals, the demands that are put on you. Think about now your community and them making emotional deposits with you all. They expect you to be there every day. How are they showing up for you? So think about having this conversation with community influencers and community leaders. If your mission is to fill in the blank, I would like to understand how that mission is coming to life every single day, every patient, every shift, every person, every time. So equity is not just an external thing, it's an internal thing. Also making an assessment to make sure that your team members have what they need. They struggle with daycare, they struggle with being able to make it to their own appointments. So equity starts at home. Transformation begins from within. And now we're credible, right? We had a program in a hospital in Monticello, Illinois. I worked with a hospital, and they started a medical weight loss program. And I said, that's great. It's like revenue-generating services. It's all clinic-based. People come in, they'll pay to get EKGs, and they'll pay to get the food. And I said, that sounds great, but let's have an honest conversation about your own team. So they said, all right, we're listening. I said, how are you going to tell your community how important it is, because they had a significant obesity challenge in their community, when you have a significant obesity challenge in your own house? So they stopped what they were doing. They did the program themselves for a year, people who worked, the employees and their families, and together in 1 year, I Scout's honor, I'm not lying, 10,000 pounds they lost together, a hospital of 280 people. Within 3 years, their community lost 30,000 pounds together. They now have a wellness trail, a fitness center that they just opened up. They didn't have that before. They weren't driven to have that before. But once you get a taste of what a healthier community looks like, sounds like, feels like, you can't go back. There's no putting that toothpaste back in the tube. You're like, I want to share the news. And now they are the model for how a small, rural, critical access hospital can be this beacon of health for communities around them. Set the example. Be that stone. You say the spark, I say be the stone. Throw the stone, watch the ripple effect. Because right now what's happening is we're all standing around the water and we're all throwing in our rocks at the same time and expecting us to have any amount of positivity as a result. So I hope that today that I've given you a few ideas, engage your entire community, examine your own practices and policy, that's so important, and invest in those who need to carry out that really important mission. And absolutely do not be afraid to reach out to your community members and ask for their help. They owe you. Because you are providing essential care. You are an asset to them, and without your organization present in their community, what hope do they have to make sure that they have equity? So I'm happy to take any questions, but I also want to ask you, if any of you have started any kind of program to address these, would you be so willing to share what that looks like, whether it's big or small, or if you're just starting? I know it's Friday morning, but I'm going to hold you to it. Ask me a question or tell me what's on your mind on this subject.
I work for an FQHC, and I think one of the things that I've only been there, a few months, but they have a bus that they go to the schools, and they put sealants on every kid. I think it's so cool that they're getting, they're just going to the community and just trying to serve. They're trying to start a mammo bus that actually has like women, they'll do women's health and bring it to the fields or to where the workers are to try to help them get that care there, just to make it easier so you don't have to deal with driving.
You're so right. I actually, when I was in DC, I had an opportunity to meet with Gina Capra, who is with the National Association of Community Health Centers, and we were talking about 100% community, and she goes, well, we do that already for our patients. And I said, yes, but not all your patients are the full part of the community. I agree with you. Like, for example, bring it to the community when you partner with your local grocery store, for example. Putting advertising on carts and things like that, please don't spend your money on that kind of thing. What I would prefer you do is work with your local grocery store to do an end cap display, and for Heart Health Awareness Month, healthy recipes sponsored by your organization, here's the ingredients, that type of thing. There are so many things because when people come to you, they're not coming to hang out for the day, and let's be honest, you don't want them there to hang out for the day. So bringing your message out, to your point, going to the schools, and we did another program where we went to a local high school. They had a serious synthetic marijuana pep spice challenge. Oh man, really, really, really bad. The kids were, they're bored. They get into this stuff. What are you going to do? But so they were at a party over a weekend. This is the straw that broke the camel's back. And 3 kids went into coma states, like coma-like, but the kids who were all high and scared, they thought one of their friends had died on the couch, and so literally they were getting ready to carry her and dump her, and I'm not joking, into a creek in the back, and another kid stopped, and well, this had been happening for a while, but it sounded the community alarm. We filled the entire high school auditorium, and it was mandatory. Superintendent sanctioned it. We had the state's attorney, mental health, ER physicians, nurses, and a panel discussion, and kids gave their testimony. Can I tell you how powerful that was for the parents to be sitting with their kids? And then we said, oh, this is kind of interesting. People are coming. So then the next year we started the Your Best Life series. 3 programs a year at the high school. One time was movie in the park. So we showed a movie about mental health, and then we had a discussion about it. I recognize these aren't the things that you can be reimbursed for, but there are tons and tons of grants available for just exactly this type of thing. So thank you for sharing that. Sir?
I mean, you know, SDOH is predominantly with all the data now. And I think that's one of the things that to get involved with the community is show them the data. This is the population has access to healthier food, not a 7-Eleven. This is the population that has access to transportation that's accessible. And those are the stuff that you need to take the community. But on the other side as well, for an FQHC, the challenge is having the people making their appointments. And I knew one strategy from an FQHC in Ohio said what they've done is scheduled the appointments around a food time, like breakfast, lunch, and they found out their appointments have increased. So there's a lot of education and behavioral change that have to go in this community. We can go and tell them this is what we need to do, but you got to change the behavior outside as well.
That's right. That's a really great point. It's part of that, you know, in that one of those first charts I showed you was about adjusting. And so we don't, you know, we're like clinics open from this time to this time because that's the way it has to be. So let's get creative about when, and I love that idea. Do it around mealtime and make sure breakfast to go. Love it. Thank you.
There's, you know, listening to you to begin with, Michelle, that, you know, it was daunting and overwhelming, and you used the word depressing. I would say at one point quite depressing, but at the same time, as your message came through, it's don't do them all, pick one or two. And that's what I'm hearing around the room is pick one or two things. Kudos to the farm workers clinics that throughout Central Washington, through the Yakima, the Tri-Cities, Prosser has a very, very good one that provides the dental services and provides, you know, they wrap it around what the community needs. Prosser Hospital as well. You talked about particular things. We have safety fairs and things like that where we take, you know, whole days out to the kids and load them with things and a lot of community activity that takes place there. So. You know, we can't do them all. We don't get paid for them all. Some of us have tax dollars that we can return back in various ways of outreach that support that. Some of us have charity programs that we just follow the state rules or we expand the state rules to maximize the opportunity that we can serve to the most vulnerable. So I think we all have one or two niches that we can do both within our organizations and also individually as well.
Yeah, thank you for that. And that's right because, you know, I mentioned I was working with National Rural Health Day for the past 8 years, and have you ever participated in National Rural Health Day, any of you? And the powerofrural.org website, every year we write the Book of Community Stars, and there's a person or an organization nominated from every state. And I have had the privilege of writing these stories and learning about a community in Kansas that had no grocery store. They're like, we're not standing for that. They went out, they applied for, they couldn't find anyone interested in opening up a grocery store, so they applied for a community grant that they started their own grocery store. and they carry no processed food. Nothing, it's all fresh. And I mean, so you can read, all you have to do is, like you said, tackle one at a time. And when you're getting ready to tackle it, look for organizations that have already done it and done it well. What I have found is they are more than willing to share how they did it. Because this is not a competitive thing. This is like strategic secrets. No, people are really willing to share with you. It's not one size fits all, but conceptually speaking, there's some pretty routine steps that we can take to get something like that started. Yes?
This is kind of just building off of what you both just said, but you know, it might seem very daunting and overwhelming to say, okay, how am I going to start this in my own hospital? How do I just create this out of nothing? But I guess the easier path forward would probably be find a local organization that provides these services, is a nonprofit that does this, and then link with them to, say, invite them into your organization to provide these services for the patients from the community. Like, or how do you bolster someone who's already doing one of these concepts, as opposed to having to start from scratch and, you know, go back and say, okay, well, how do I even create this? But find it where it's created in your area, and then link up with those and join those other organizations that focus on these individual things and provide that and just empower them and bolster them, and you know what I mean, as opposed to just recreating the wheel. But find it already in place and then try and help that expand.
Yeah, because if you try and do it on your own, that means that you're not shifting the burden. So I will just say it does start with an invitation as the health leader of that, you know, your organization, so the leaders in your group, sit down and have a strategic planning session around what do we want to accomplish here? We want a healthier community where everyone has access to what they need. Now, we're not going to be able to make sure that everyone has access to everything they need. That's the ultimate goal. Now, that's the big picture vision. What are the steps that we can take? Then you convene a meeting. I don't call them town halls or anything like that because they're so contentious. It's a visioning session. What is the vision for the future of this community? And you get your faith-based leaders, your school leaders, your chamber leaders, your Lions Club, your Gardens Club, your Zion's Club. I know you have many of them. And you may not have a relationship with them, but they all want you to be thriving. They need their local help. And you sit down with them and say, here's our vision. Do you share that vision? And then if you see if you can get stakeholders, and then you form something more, you have something more formal. I encourage you, if you want more information about how the whole 100% community process works, I've got all the information you need, and I'm happy to connect you with those resources.
I just wanted to say thank you for the great presentation. I think this is very important information, and you know, as hospitals or health systems, I think we absolutely have an obligation to support this, and not only support it, but put our money where our mouth is at times to really show our support. I thought I'd share a few things that our organization does or has been doing. So one of them is that we saw a need in one of the communities where there wasn't really great access to healthcare in schools. So we actually created a clinic in one of the high schools, and we staff it, and it's kind of a community partnership where it's in the school, so there's services that the students can access if they need it. So I thought that was a really cool thing that our organization did when I heard about it. Another thing that we do in one of our other communities, so in Spokane, they have the largest 3-on-3 basketball tournament in the world, and so that particular event we sponsor, but on top of that, we provide free services for people that get injured. They can go to one of our tents and get free, access as they're playing. And while that's not necessarily as maybe long-term impactful, they know who we are, and they know that we're there to support, activities that really are both fun, but also, engage the community as well. So that's another thing. We also support multiple organizations with just grants that we provide. So we have a whole grant making fund across our organizations where organizations can apply in the communities to provide services that impact this specific example of, and it's not really narrow focused. There's certainly, varying organizations, but we also think that it's important that community organizations are the most impactful in supporting our community members. So providing those resources is important.
It's essential, and to your point, yes, it is our obligation, but not just because we don't do it just because we have to. And I don't like to shit on people, but we should be doing it because we want to. It's within us to carry out this mission. I think about a hospital that I work with in another state and rural community, and we've done this in urban too, where the youth advisory council, the hospital convened, kind of driven through the health clinic, because we want the health clinic to be a big part of this. They convened a youth advisory council, and the youth advisory council's responsibility is to create and stock a comfort closet within the high school for those peers of theirs who might not have deodorant, toothbrushes. It makes me joyful when I see the work that just a few people can do, and it breaks my heart when there's so many simple things right in front of us that make a difference for people. So I appreciate hearing those examples, because I say this: if not us, who? If not now, when? Our healthcare organizations can no longer carry this burden alone on their shoulders. Your communities rely on you, now you rely on them. So if nothing else, I encourage you to think about this, write down a few notes, sit down around your local coffee shop with some community leaders. I know you know who they are. You meet with them often and say, we've had the same conversation over and over and over again. I'd like to challenge us to have a different conversation for the purpose of ensuring that 100% of the people in our community have what they need, first and foremost, to survive. But why stop there? Why shouldn't we all thrive? The answer to that question is there's no reason, no good reason. If we have some measure of control, we can steer this ship in a different direction. I really appreciate being here. I thank you so much for your time. I'm willing you all very safe travels home, a great rest of your day. And if you want to reach out to me, you'll find me. I'm out there. I'm not hard to find. I'm on Twitter and LinkedIn, Facebook. Just reach out. Just say HFMA, Alaska, Washington, and I'll know that you are not a bot and a real person, not trying to spam me. So thank you.